To some, cats and dogs are just animals, but to pet parents, they're a part of the family. Local 3's Audrey Pentecost has more on what to do in the unfortunate case your furry friend has an emergency.
Cat and dog owners can all agree it can be very nerve-wracking when you think something is wrong with your furry friend. In a place like Michigan's Upper Peninsula, emergency veterinary care can be difficult to find, so it's important to know what to do in the unfortunate case your fuzzy family member is experiencing an emergency. Bethany Rudness, a second-year veterinary student at Michigan State University, held a presentation at UPAWS where she went through some basic emergency care and tips for cats and dogs. Since our fluffy fellows can't talk to us and tell us what's wrong, it's very important to know how your cat or dog typically looks and acts so that you know when something pawful is happening.
So a couple of things that I'm going to talk about specifically are kind of looking at what's abnormal in your pets. So a big thing that you always want to be aware of is what do their gums look like, the color of their gums, if they're pale, if they're white, if they're blue, if they're yellow, those all indicate that they need to be seen. We want to see that they have nice pink or pale pink moist gums. Other things to look for: if they collapse acutely, they're laying on their side, they won't get up. Rectal temperature above 103, 104 Fahrenheit is of a concern. Seizures, just kind of basically if you're concerned, bring them in. That's your best choice. You know your animal best. You're with them every day. So if you think something's wrong, something's probably wrong.
As a pet owner, it's very important to know what common household items can cause problems with your pets and what the reactions can look like in the case your pet has been exposed to them.
So one of the most common ones that we're seeing is marijuana, so THC toxicity. Your pet is going to be drooling, they might be sleeping really hard, they're kind of unresponsive, they may have seizure-like activity, they may be dribbling urine, but that's usually not an emergency. They usually just need to sleep it off. If you know that they got into marijuana or edibles or anything like that, know what they were. So if they contain chocolate or if they contain xylitol sweetener, make sure you let the vet know. Otherwise, we can give them fluids. We can monitor them to make sure they're okay, but usually they just really need to take a good nap. Other things that they can get into: chocolate is still in its own category. Dark chocolate, baker's chocolate, and cocoa powder are the worst. Other human over-the-counter medications, ibuprofen and Tylenol or acetaminophen, are really bad. We're coming into the time of lilies as well, so toxic plants in your household, be aware of those. If you have a cat, you should never have lilies in your house. Household like cleaners, bleach, hand sanitizer. Dogs will eat anything, so if you leave it out, they're probably going to eat it. So try your best to kind of lock those things up like kids.
Just like if you have a child at home, it's always a good idea to keep some first aid items handy.
A couple things that you can always keep on hand, things like gauze, medical tape, vet wrap, which is kind of just like an elastic kind of bandage that stretches really well and stays super secure on them. A dedicated thermometer to your pets, Vaseline, sterile lubricant for wounds and for the thermometer, ice packs, disposable gloves for yourself, towels, muzzle. A muzzle is never a bad thing to have for your dogs. We hear it all the time: my dog would never bite me. If my arm's broken, I'm gonna bite my mom. Okay, so a muzzle is never a bad thing to have. E-collars, if you've gotten one from a surgery, it's never a bad thing to keep, just because you could need it again, and then you'll have to pay for it again if you return it.
Reporting in Sands Township, Audrey Pentecost, Local 3 News.